beginning of.
Mr. Patterson, I'm going to, you have a couple of our colleagues who are
but
waiting to get in.
I appreciate that, but I would like to ask if it's possible for me to ask the opposition to respond to the, I'm not going to re-ask the questions and all of that. You've heard the discussions back and forth, the questions and concerns. Can we give them a minute or so just to respond to those questions in general? You can pick whichever ones you'd like.
We can, we will, and then we're going to Mr. Chavez, and then Mr. Chu, and then Ms. Waldron.
We have very high vaccination rates in the state of California. We have a vaccine against whooping cough, which doesn't work well enough. This bill will not decrease the spread of whooping cough. Influenza, we haven't had a good flu shot for a long time. Experts admit that. 130 cases of measles in a state with 39 million people is a random statistical event. It stopped. We have very high vaccination rates. We don't need to force full vaccination. We don't need to enforce a full vaccine schedule on children. Assemblywoman Burke, your child is 18 vaccines behind as of 11 months, unless you've had partial vaccination, in which case your child is only 8 or 10 vaccines behind. And I don't think that we're going to have an easy time getting exemptions for those children, and that scares me.
I'll just add to the question about how's California doing. In January of this year, the state issued an immunization report card. The first 2 lines of that report card said, as a result of, I'm paraphrasing, it said, as a result of California's effective immunization laws, California public school children and child care children are well protected from vaccine preventable diseases. So that's the state's own position, that the laws are working and California school kids are well protected.
Thank you. Assemblymember Chavez.
Thank you, Chairman. And by the way, you're doing a great job running this meeting. It's a tough one. I appreciate what you're doing. I'll announce to the group. Everybody's been asking me where I'm at on this. I guess I'm kind of I've not made my mind up, as Dr. Pan, you and I have talked before. But I'm listening intently to the discussion, and I'm just going to ask you a couple of questions to kind of focus me, and I'll go to the other group. And you don't have to give me the big speech. I just kind of want to get the answer.
No laughing, please.
On 8 April of this year, you voted in support of SB 445, which was for homeless children, and required that they have no vaccine. Actually, it says, and I'll read it, the new school must immediately enroll the homeless child, even if the child has outstanding lists about fees, books, and everything else, when it goes down to medical records, including records or other proof of immunization history or proof of residency. What was your thought process in 8 April to vote for that bill, yet have this bill coming forward, that you would allow children into school without a record, though your bill says they have to have an immunization?
So basically, we recognize that children who are homeless don't really have access to their immunization records, what we want to try to do is, of course, this is back to conditional, right? So what we want to try to do is, and that's why we have existing laws about conditional admittance, that we believe that if we can so these are children who have not intended not to get vaccinated. They're children who we believe will intend to get vaccinated, and therefore we want to work with the school district, because after all, I do believe that we want to try to get every child educated. Every child's a right to an education. That those children are able to get started in school, and then we will get them connected with a physician and the clinic and get them vaccinated so that they will be protected and help protect other children in their school.
And I thought you said, so the logic was that it was more important to get the child into school, which is a constitutional right, and take care of the immunization at a later time. Is that correct? Did I state your logic correctly?
This is in terms of compliance with federal law in order to be sure that they get into school. And again, these are children where there's intention to get them vaccinated, unless, of course, they have a medical condition on evaluation, in which case they would get a medical exemption.
I appreciate that. Just trying to understand the logic.
Sure.
My next point is, on AB 2109, and I went back and saw your testimony on that you did on why you did it. Your logic there appears to be opposite than the logic you're having today. Okay. So give me, not talking about this bill, what was your logic on AB 2109 to educate parents and give them free will? Why did you make that decision back to AB 2109? What was your logic there?
So both bills are consistent in trying to get our immunization rates
I didn't mean this
up.
bill. I'm talking about
I said both. That's why I said AB 2109. Okay. The purpose of AB 2109 was to get our immunization rates up high enough so we can protect herd immunity, community immunity in their schools, to prevent the spread of outbreaks. Right? And what happens, we saw in the state of Washington, there was a law that seemed to, in its first year, demonstrated that it would decrease the use of PBEs and try to help increase our immunization rates. Unfortunately, as I've explained earlier, that promise is not held out in other examples. We, of course, only have 1 year experience in this state, but other states, similar type laws, have seen basically a 1 year short-term decrease and have not seen a persistent decrease. So it would not achieve the aim of achieving that community immunity that was always the goal of AB 2109 and also the goal of this bill.
And I understand that. And that's what struck my attention when you talked earlier about 2109, knowing the fact that 2109 only went in effect September of last year.
Correct.
And the breakout in Disneyland, it was a December-January effort. And your bill came through the second week of February, which is only 3-4 months after 2109 went in effect. So in your own statement you just made, you said you did not see the impact upon the PBE, but you couldn't have seen the impact when you started the bill because we had no results from the bill yet.
Well, as I indicated, when you look at this is the first year for AB 2109. It was modeled after a law that was passed in the state of Washington that was actually passed prior. In fact, we've had about because it started in 2011, we've actually had about 3-4 years of experience in that law. And so when we looked at what happened with the results of that law, which is very similar, of course, to the 2109, because that's what we modeled it after, we only saw a temporary decrease. We were very excited they had the first year decrease because that's when we passed 2109. And then we didn't see any further decrease. And that is the concern that basically we would see the same thing here in California.
And that was Washington. My point is just trying to draw a line in California. We started, and 4 months later, we had this law coming through. I guess somebody remember Senator Allen. Since you took the legal point, I was wondering about this. I heard the term compelling state interest. And being a Marine, a guy who shoots guns, I'm not really into law stuff, but a compelling state interest. I understand for a compelling state interest, the states have to prove that to impact upon an individual's freedom. And in California, we have a constitutional right for education. So explain to me from a legal perspective the compelling state interest to implement this law to impact upon a parent's right for education for their child, which is a constitutional right. And I'll follow on to my other lawyer after you answer.
Okay. Well, it's a great question, and I think ultimately, it's at the very heart of this discussion. So this compelling state interest that was in this right to education is codified in Serrano v. Priest decision in the early 70s that actually came out. It was a school finance case that looked at the fact that we had tremendous disparities in how we were financing school districts from region to region that helped, that mirrored the disparity, the poverty and the economic disparities that existed from one area to another. And the court finally threw out that entire financing system, saying that we weren't offering equal protection to students based on the fact that they were growing up in a place of poverty, in a place where there was socioeconomic disadvantage. So the question becomes, is this bill necessary to achieve a compelling state interest? And the courts have said over and over again that the protection of public health is absolutely a compelling state interest. And they've said that specifically with relation to vaccines. The Phillips case that I mentioned I only mentioned it because I have a long list of cases. I only mentioned it because it literally came down this year. There are actually two not as recent but pretty recent cases. Fourth Circuit Workman case, Brown v. Stone in Mississippi, that both upheld bills that were much stronger, actually stronger than 277 in their respective states, on both First Amendment and both on First Amendment and 14th Amendment grounds. So the question we have as a legislature now is, hearing all of the issues here, hearing the public health implications at play, is there a compelling state interest? Our public health officials tell us unequivocally that the answer is yes. That's up to us to decide. I certainly have listened carefully to the science, and I feel as though there's a compelling state interest. But that's a determination for each and every one of us in the legislature to make. Whether the case has been made that there is a compelling state interest to take this sort of action. Now, of course, let's be clear. This does not deny children an education, but it certainly does restrict parents' options. There's no question about it, and I'm not going to try to mince words. But there are other options that will exist. Obviously, we've talked about homeschools. Obviously, we've talked about this independent study mechanism. I think that the amendment that clarified the fact that nothing in this bill should impact the ability of a kid to get the full program afforded to them in their IEP is an important change that I very much welcome. And so those are things that will certainly that mitigate against the idea that this is unduly restricting a student's access to education, but this is certainly a restriction, and this is the determination we need to make, whether we've met the grounds for a compelling state interest. I think we have, but you may feel differently.
Thank you very much. And sir, would you like to comment? This will be my last question.
Thank you for the opportunity. Again, with all due respect to Senator Allen, the first case that he cited, it was a law that did specifically allow a religious exemption and some degree of parental right. I think he also, let me please finish. I think he also is quoting a case that was decided under Mississippi law, which I'll just point out California affords very different set of educational protections than the laws of Mississippi. The analysis that the court does, I'm a student of this and I teach this educational law analysis. So the analysis that the court does when you attempt to limit or deprive a fundamental right is a very specific one. The court will not look at, is public health a compelling state interest? In this case, the court won't even look at, are vaccines a compelling state interest? It's a narrow analysis. And what the court looks at is there a compelling state interest to remove the personal belief exemption in light of what's going on? So that's the first prong of the test. I'll point out again, no court has ever found under California law a compelling state interest to deny or limit any access to publication. It's a two-part test. The second part of the test requires a finding that the law limits the right, the fundamental right, in as narrow as possible way. And existing law already provides that opportunity. Under existing law, if there's an outbreak in a specific district or community, the school board has the right, without any additional legislation, to temporarily not allow certain students who aren't fully caught up on vaccines from attending that school. So that's an example of something that's narrowly tailored. Another narrowly tailored example would be if there's a pandemic outbreak in California for a specific disease, a court might find that mandating that students receive that vaccine could be narrowly tailored. I know that the author talked about the likely litigation that will ensue if this bill is passed. The ACLU has sent a letter to the author raising the point that I raised about a compelling state interest. Given the disproportionate negative impact that this bill would have on Black and Latino students, and especially in light of the recent admission that the CDC had ordered its scientists to withhold information showing that Black boys under 36 months were much more likely to develop autism if they received the MMR vaccine within the first 36 months. Given those pieces, it's likely that organizations like MALDEF, NAACP Legal Defense Fund, disability rights group throughout the country, in addition to all the parental rights groups and individual students, and the state will be mired in waves of class action litigation to stop this law from coming into effect.
Well, thank you very much. Senator Allen, did you want to?
Yeah, I did. So a couple things. First,
I was just going to cut it down because I'm trying to get on.
Yeah, no, I know. And just with respect, two critical things to mention here. First of all, the other cases that I mentioned actually did involve a religious exemption, and the courts. There were situations where a religious exemption did not exist, and the court said that was okay. That's the first thing. The second thing is the ACLU did raise concerns. It also raised concerns to say that just because your rights your rights to make choices don't trump the rights that I have to make sure that my kid can be safe in school. And the final thing I'll say is that, unlike in the case of Serrano v. Priest and all of the situations that you're talking about that involve distinctions that are difficult to get out of, people. In this case, we're talking about a choice that's been made by a parent not to vaccinate. It's not an inherent quality that existed in all of the civil rights discrimination legislation and litigation that Serrano was part of, including the wealth distinction.
Well, thank you very much. I'll just close with this comment. Truly, this discussion we're having here is not about vaccinations. I think it's about freedom. I think somebody used that in the beginning. It's about freedom. I'm looking at this and trying to figure out, before I impact upon people's freedom, what is the problem? What's the problem we're trying to solve? And the fact sheet I have here from the California Department of Public Health says very clearly that implementation of statewide requirements have been effective in maintaining a 92% immunization coverage among children in licensed care facilities and kindergartens. So even our own state recognized that. So I'm just wondering, what is the problem? I haven't made my mind up yet, but I appreciate the discussion on this.
I don't think that was rhetorical. Did you want an answer from the author, or? No. Oh, that was a statement.
That was a statement.
Okay. Let's go to Assemblymember Waldron.
Yes.
Okay, thank you. I have 3 questions, but I'll be as quick as I can with them. With the amendment regarding the physician's professional knowledge recommendation being added, after we had our talk yesterday, Dr. Pan, I continued to do some research, and I was on the CDC website and, trying to figure out, okay, you've got personal belief exemptions. We have the religious exemption. There's also the medical exemption, which is still now within SB 277. So what I was finding was, with this amendment, would you say that SB 277 would still conform to the CDC guidelines regarding a medical exemption?
There's no requirement in the law, and I challenge you to find any text in the existing code or in the bill that states that the physician has to exercise any more than their own professional judgment. That professional judgment, of course, subject to review by the medical board. And I mentioned the medical board has never investigated or removed the license from someone for granting a medical exemption for immunizations. So the law very clearly states it is up to the physician's judgment. The existing law, we've taken an amendment to clarify that point. The Department of Public Health doesn't review the exemption and has to approve it or review it. Right? It's simply the physician writes a note to the school saying that there is what's the reason, duration, which could be indefinite, could be forever if that's an ongoing condition, and they sign it, and the child now has a medical exemption. It is very straightforward, very simple, and it's really the physician exercising their professional judgment about if the immunization could cause a harm to the patient.
Well, the question is really about the CDC, what they're requesting.
Well, the CDC has guidelines, but those are guidelines from the CDC. The CDC has guidelines for a lot of things, and so they're used by physicians to help us be able to be sure we're applying the best science and knowledge. Right? They take and that's what they provide. But it's not a mandate or a requirement that physicians, there's nothing, again, in the bill or existing code, I challenge you to find it, that says that a physician has to apply only the CDC guidelines.
Okay, because that kind of answered my question, because it seems like with that amendment, it's a lot more looser interpretation than what the CDC is requiring. Okay, so my second question, just to be really fast, is under this bill, is the parent still required to sign a consent form for the child to be vaccinated? So when you go to the doctor.
So yes. I mean, there's nothing. This bill is about having your child enroll in school, or potentially, the existing law for daycare in school, and it's about enrolling children in school. So the child visiting a doctor would still have to the parent would still have to provide consent before we would immunize a child. That does not change under this bill.
So why does the parent have to sign the form?
Well, they are signing a form saying that they give consent to their child being vaccinated. You're talking about when the child gets vaccinated.
Right.
Right. I mean, that's because they're acknowledging they have received the information from the physician or their staff about the immunization and the diseases, and they would sign a form saying they've consented to that. That is what physicians do in their practices to ensure that they obtain consent.
Okay.
So it has nothing to do with this bill.
Well, because if a parent, the way I looked at it is, when you sign the consent form, you're basically saying or admitting as a parent that you're responsible for the health and welfare of the child. The doctor couldn't sign the consent form. The state can't sign the consent form. So I'm saying that with SB 277, unless you're going to homeschool your child, why should they have to sign a consent form if they're going into public school? Because there is no real consent. Because the responsibility now should go to the state, I guess is what I'm saying.
So I presume you're talking about consent for the child to be immunized, right? So remember, this bill is about enrolling children in school. The decision whether to immunize or not is something the parent makes with their doctor or other healthcare professionals providing the immunization. That is separate from school entry. When they then bring their child to school, the school will say, please present your immunization record and your school form, and they would say, okay, your child may not, of course, the parent may also receive a note from the physician saying that there's a medical exemption, so they will review that, or conditional, and then they will decide whether to allow the child to enroll or not. But that is not about consent for immunization. Consent for immunization happens between the parent of the child or the guardian and the healthcare professional who is providing the immunization. That is not changed at all in this bill. There's nothing in this bill that changes that part of the relationship. This bill is about entry into school and entry into basically it's about enrollment in school. So there continues to be informed consent for immunizations, and if a parent says, I don't want to get my child immunized, then the child is not immunized. That is what will happen. And then when they decide they want to enroll their child in school, then the school will say, well, is your child immunized? And then they will have to then if they decide not to have their child immunized under this bill, they would have to then seek out options like homeschooling or independent study. That's what this bill is about. But the decision whether to immunize or not is a decision that's made between the child's parents or guardian and the health professional that is providing the immunization.
So the state under SB 277, I know the answer to this, but it seems as though if you want to send your child to public school, you have no other option to homeschool, you must sign that consent form, even if you really don't want to, because the state will not take the liability, because the total 100% liability is on the parent.
No, like any other medical procedure, you have to grant consent to get immunized. This is not because it's for school entry. The reason you sign a consent is because we are administering a vaccine. We are administering to the child. So just like if we decide to remove a mole from your child, we decide to give them perform another procedure on your child, we of course would talk to you about getting consent. We would get consent from you, explain the risks and benefits, and then you decide, are we going to do this or not to your child? And if you had further questions, that's what this is about. So that is completely that's separate from this bill. Obviously, the act of deciding whether to immunize your child or not is something you discuss with your healthcare professional who's going to immunize your child. That is separate from this bill. This is about enrollment in school.
Could I ask the opponents to weigh in on that?
99.99% of children under federal guidelines do not qualify for a medical exemption. This bill is going to basically be blackmail in terms of somebody like his child. And my child, who had a severe reaction to a vaccine in 1980, my other children would not qualify under this bill for a medical exemption, and my other children would not be allowed to go to school. This is not right. There are people who are vulnerable to vaccine reactions, and this bill throws them under the bus.
And I believe you deserve a short answer to your question. No, we would not be in compliance with CDC. The CDC, the Committee on Immunization Practices, the American Academy of Pediatrics would be apoplectic about the loosening of all of these guidelines, and yet I do like the amendment because if this bill passes, at least there will be some discretion. But no, we are way out of compliance with the CDC.
Okay, my last question, very quickly. I guess I'll ask the opposition regarding the constitutionality. If you could weigh in on that.
Sure. So, I know that this is a matter that will likely be brought before the courts. But as I mentioned, in the state of California, the right to education is a fundamental right. Because it's a fundamental right, there's special protection, and any law that tries to limit or in any way inhibit that has to pass the two tests that I talked about. The first test is there's got to be a compelling state interest, and again, the compelling state interest is for the specific law that's being passed. So a compelling state interest to remove the personal belief exemption. The second part of the test is the law has to be narrowly tailored to limit the right to education as little as possible, which I think this bill is the opposite. It's very broad. That's just the constitutional analysis under California's Constitution. In addition, we've got the Individuals with Disabilities Educational Improvement Act, the IDEA, which is a federal law. California mirrors federal law in this respect, that requires that kids with special needs, in California we say kids with exceptional needs, but kids with disabilities must be educated in the least restrictive environment. And what that means is, to the maximum extent possible, they have a right to receive an education with non-disabled peers, and the only exception for that is if the child's disability prevents it. That's the only exception. There's also a procedural protection under the IDEA. It's called a stay put right. And with that, it's a procedural protection for parents. And what it says is, if the school district, or the state for that matter, wants to change a child's educational placement, in this case from a public school placement to a homeschool placement, that cannot be done, and the parent disagrees with that decision. You've got to go to a federal judge and get an order from a federal judge after the federal judge hears the evidence, and the federal judge has to agree that the changing of the placement is appropriate for the child. The last law that we have that's implicated, again, under the education rubric, and this is a more recent law, it's from 2006 in California, but there's a federal law as well, and it prohibits conditioning anyone's access to a public education to the requirement that they receive a prescription for medication. You recall a few years ago there were a lot of attempts to kids that had certain behavioral issues. There was a lot of attempts to cause them to be medicated before they came to school. So the federal government, and California followed, passed a law and said you cannot condition a kid's right to attend school based on them taking any sort of medication. Now, granted, that's a different situation from the vaccine, but I think what it shows is a very strong policy concern around not conditioning the right to public education on any medical requirements, including ones that are intended to be for the benefit of other students. So thank you for the question.
Dr. Wood? I'm sorry. Senator Allen.
Can I just make two comments? First of all, about the IDEA issue, and it's possible that the speaker hasn't. I don't know if you have a copy of the amendments, but I think that the amendments that were made with respect to the IEPs were absolutely dead on address the IDEA concern. That nothing in this section shall prohibit a pupil that qualifies for an IEP pursuant to federal law and Section 56026 of the Education Code from accessing any special education and related services required by the Individualized Education Program. And most IEPs do require a mainstreaming component. That's part of the law. That's part of the movement. So I just wanted to make sure that this new amendment, I think, head-on addresses the concern about IDEA. The only other thing I wanted to say about Serrano and this issue of the compelling state interest is that, in the end of the day, the core of the equal protection concern really comes down to whether the bill discriminates facially against a suspect class. And in this case, it absolutely does not. The Serrano court, was a case involving legislation involving suspect classifications touching on fundamental interests. Those are suspect classes are those folks with immutable characteristics, and I think in this case we just don't have that.
Mr. Chair, Senator.
Wait a second. We're not going to go back and forth. If someone wants to ask you a question, they may.
Thank you. Just to correct a couple.
But I just want to make a quick comment here. We've had a number of questions about the educational components of this bill. And I wanted to let you know we have a member of the California Department of Education here. Should a member wish to pose a question in that direction, we also have a member of the State Medical Board here to assist if necessary. You don't have to. I'm just letting you know that we have resources available if you have a burning question. And I also want to say this. I appreciate our members' engagement, your thoughtfulness, your questions. We also have many folks who are here who have been patiently waiting to make comment, and they all are going to have their chance to do so. So I want to move as efficiently as we can towards that. But I also want you to ask your questions because you're the ones voting and you need to be comfortable with your decision. So let's go to Dr. Wood, and I don't have anyone else on this list. So, okay.